Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gollin.
Welcome to the Gastro Girl podcast. I'm your host, Jacqueline Gollin. This episode is produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Today, we're shining a light on something many IBD patients experience, but don't often have the space to talk about: the emotional and psychological impact of life with Crohn's disease or ulcerative colitis. Now, these are not just digestive system conditions. They can affect how you see yourself, how you eat, how you connect with others, and how you cope with uncertainty. Joining me today is Dr. Laurie Keefer, a leading psychologist and resilience expert who just published a powerful article in the American Journal of Gastroenterology entitled Beyond Depression and Anxiety in IBD, Forging a Path Towards Emotional Healing. Now, today we'll explore what emotional resilience really means, how trauma, disordered eating, and adjustment disorders show up in IBD, and how patients can start building emotional strength today using the Resilience 5 framework. Now, let's get started. Well, thank you for joining us today. So great to see you, Dr. Keefer.
My pleasure. Thanks for having me, as always.
It's our pleasure. So we're just going to get started. So excited when I saw your article in the American Journal of Gastroenterology. And Dr. Keefer, in your article, you talk about how the emotional impact of IBD, which is inflammatory bowel disease, most often recognized as Crohn's disease or ulcerative colitis, how the emotional impact of those conditions go far beyond anxiety and depression. So can you kind of help us understand what are some of the hidden burdens that patients experience?
No, I'm so glad you asked that, because I think, we've done a really good job over the years in sort of talking about what happens when people have depression or anxiety disorders and how that affects their GI outcomes. But I think it's so much more beyond that. And in fact, you could probably argue that things like depression and anxiety disorders are negative outcomes of poorly managed emotional health, right? So I like to really look at the basics of point of diagnosis, point of transitions in your care, pre-habilitation before a surgery, post processing of a hospitalization or a treatment failure, right? All of those things are compiled to become more serious mental health problems if you're not addressing them. And so fatigue, sleep, feeling like a burden, having difficulty adjusting, medical trauma. What do I eat? What do I not eat? What's my relationship with food? What's my relationship with others going to look like if I'm a little less committed, a little less able to commit to certain activities or travel? Those are all really important, common emotional considerations. And I hope we can keep talking more about that and not just depression and anxiety.
Yeah, and I'm glad you mentioned that because they're even at every stage of the patient journey, just getting the diagnosis, that's a shock. Or trying a new treatment after being on something that wasn't quite working. And then there's the worry and anxiety and even grief, like grief to your former life and what you were able to do, and at least initially what you may think you can't do anymore. So, I mean, let's talk a little bit about these factors along the patient journey. Like, what are some of the things that patients are experiencing that we should be bringing to the surface?
Absolutely. I mean, I think isolation, right? Why me? How am I different? How my relationships change is a big one, right? And so much of IBD is about redefining your community, who's in your life, who gets it, who doesn't. And that's a shock. And many of these patients, as you know, are diagnosed in their 20s, right? Which is like such a tumultuous time anyways for all of us, right? You're building relationships, you're building career, maybe you're going off to college, maybe you're graduating, maybe you're having children, like that. There's a lot going on, and that diagnosis overshadows a lot of those transitions. Mostly, I think, because of community. Like, who do you know that's living their lives to the fullest with a chronic condition, right?
Yeah. And I think a key, and I've followed you for years, and your work has been just groundbreaking, especially as it relates to digestive health and GI. And one of the things that you spoke early on about, and I know you're a colleague of Dr. Doug Drossman, was the biopsychosocial model. And it's great to see in the last 10 years the
Yeah.
evolution of our understanding of the biopsychosocial model and how that applies to patients and the model of an IBD. So can you explain what this means for patients?
Yes. So, when we talk about biopsychosocial, we are really talking about the intersection of biology. What is going on? Where's your disease located? What symptoms do you have? How much inflammation is going on? How much pain are you in? How much fatigue do you have? All of those very like complex biological components. And then how do those how are they also influenced by psychological factors, grief, trauma, history of other negative life experiences? Maybe this is the first time you've dealt with something, maybe this is the 150th time you've dealt with something. All of that matters. And then the social component: where do you live? Who's in your life? What doctors do you have access to? What kinds of food access do you have? All of those things. We can't separate those out, right? It's very complicated, but I think we've really tried to build over the last many years, and you mentioned Doug Drossman as being, a key leader in that part of the field, is just really holistic care of patients, making sure that we're not just sort of compartmentalizing all of these things, that your GI doctor knows about your social history and your GI psychologist knows about the biology, and that everyone's kind of working together.
And what I think is, from the patient standpoint, what I think is so interesting about this approach is also for patients to think about their health status or their condition from the biopsychosocial. So it's not one thing, right? And I think this is really important. And I love some of the models that the Rome Foundation have done, the clinical, I forget those books, those clinical
Yes.
pathways. And I always wanted to think of the patient having its own version of that, where they can think. So when the provider's asking questions in the office about some of the things going on in their life, are they going through, if an IBD patient's going through a divorce or trying to get
Yep.
pregnant or just lost a job,
Yep.
those are questions that should come up in the visit, correct?
That's exactly right. And by the way, it doesn't negate the very real nature of your disease, right? I think
Yes.
a lot of times people are afraid to bring up the psychological because they're afraid then their doctor's going to ignore or attribute their symptoms to something psychological and miss something biological, right? But if you're doing it right, all of those things can be true. You can have inflammation and have lost your job, um, and need a neuromodulator for your pain all at the same time, right? And so I think you're right. Patients also need to think through these things, that biologically it's not an either or, right? Just because you're stressed doesn't mean that takes away from what is going on with you medically, right?
Yeah, I just remembered it was the multidimensional clinical profile. And I
Yes.
always wish we had a patient version of that. So when patients are thinking about preparing themselves for the office visit, they're thinking in the same way the physician should be thinking about asking questions. I love that.
That's such a great idea, right? And we always talk to patients about like mapping your journey,
Mhm.
your IBD journey, right? And where do you fall in that list? Because there's times in your life where things are more brain related and sometimes they're more gut related. And it's helpful, I think, to think about that intersection. I mean, the brain gut is probably one of the easiest mind body examples in medicine.
Yeah, let's talk. I love this. I'm glad you brought that up. Let's talk a little bit about that intersection and why it's so important for patients, but especially for IBD patients, because I think we're really trying to focus on this population here in this episode.
Yep. Right. So, other than maybe the skin, the brain and the gut interact the most with the environment, right? Which means it's very easy to get that dysregulated process going. And that can be because you've had a long period of inflammation, and that even though that period of inflammation is over, or that period of infection is over, that your nerves are still very, very sensitive to things going on. Food, need to have a bowel movement,
Yeah.
stress, all of those things. And the brain is doing its job, which is to like take over and overregulate, over orchestrate what's going on. And we need to be able to teach it that it doesn't always have to pay that close attention anymore. Right. And so,
Yeah.
what might have been helpful when you needed your appendix out is no longer helpful after that, right? And so
Yeah.
turning down those signals and the brain saying, it's okay, I can trust my body to know that there's no apparent threat right now, and that this is something that I can control on my own, is that connection between the brain and the gut that we're really trying to optimize, especially for the IBD patient, right? Because there are things that we can point to: strictures, abscesses, surgical sites, ostomy bags. There are things that are very much threatening, and being able to say, it's okay. I know what the difference is between my stricture pain versus my stress pain, right? I know what the difference is between eating too much and feeling full and a bowel obstruction. We're always trying to manage that with our patients so that they don't drain their batteries all day long, focusing on every single signal that they feel from their gut.
Yeah, and I know you've mentioned over and over again, I've heard you talk, and read many of your papers, and you really focus on the biopsychosocial model as really encouraging whole person care. And it emphasizes something that you've been working years on, which is the resilience framework. And I really, if you could give us a basic overview, and then we'll get into what it actually is and why that's important to build this resilience alongside the typical medication or therapeutic treatments that go along with an IBD
Yeah.
management.
Oh my gosh, that's my favorite thing to
I
talk.
know it is.
So, we've really, over the years, have really tried to boil things down into this, what we call the resilience five, right? And the question was really, what is it about the people who really do well, that really thrive despite having terrible disease, despite having gone through a lot? What is it about them that allows them to still pursue what they want, right? And so we really focused more on the character strengths of our patients, and figured out how to bottle that up for the people who maybe were struggling. And so that led us to sort of five broad themes of what we think everyone should have when they're diagnosed with inflammatory bowel disease, beginning with the acceptance of the diagnosis, right? I accept it. I may not approve it. I may not want it to happen. I may not think I deserve it. And I may not be looking forward to a life with it. However, I have it and I have to act. Learned optimism, right? Things happen for a reason, that is not personal, that is not permanent, and is not pervasive, right? People who are able to change the way they attribute negative events do a little bit better when they have IBD. Being able to regulate emotion. So we talk about self compassion, being able to breathe through things, being able to relax, being able to know when a problem is solvable versus not solvable, is really, really important as part of that overall self regulatory compassion flexibility component. Um, we talk about social support, right? So we know that one of the things that helps build resilience is to have role models, to have people that can comfort you, to have instrumental support. So, who's going to take you to your colonoscopy? Who's going to pick up your medication when you're too sick? To informational support, right? Who's going to tell you about the latest treatments? Who's going to, point you in the right direction? Things that, Gastro Girl really does a great job of building community and support. And then the last thing is that self-confidence. Do I know how to do what I need to do to get it done? If everyone has those five: acceptance, self-regulation, social support and community, learned optimism, and self-confidence, we've effectively treated to target, and anything that comes their way going forward will be manageable. Um,
No, that I love this. And I love this episode because we sometimes we get caught so much on describing a disease and talking about the disease. And
yeah,
I love these episodes that really focus on it. We already know that there's these burdens. We touched on them, but this is really the main point of this. We want to give
yeah,
patients tools
yes.
and positive and optimism, because the mind over matter. I mean, it sounds so simple, and the way you use resilience, you talk about it's not about perfection. So what is it about?
It's really just being able to roll with the punches, right? It's about adaptation and recovery. I always compare it to sort of that bridge going from point A to point B. You really want that bridge to be strong and solid and built by professionals and experts, but it also has to have a little give. It needs to be able to handle a wind, a flood, a boat crashing into it. It needs a little bit of that ability to recover. And I think that that's sort of a nice metaphor for what we're talking about here, right? Point A to point B requires a lot of both professional, expert, rigor, but also flexibility and adaptation, and this idea that I can recover from things. It's not about perfection.
Yeah. So our listeners may be listening and they might be thinking, they don't, we may not know that we're struggling emotionally until we hit a wall, right?
Yes.
And before I talked to you about how a patient can incorporate resilience and how they can learn this or get more support for that model to implement in their life. What are some signs that they actually should seek some support and not be embarrassed about it?
Yeah. I mean, ideally, it's a great question because I see this obviously. There's a reason there's a full-time psychologist in an IBD center, right?
Yeah.
Because we see this. This is so common. And, I think patients are often afraid to bring it up to people because they don't want to be perceived as a burden. But, you know, it is okay. First of all, it's common to have these very negative feelings, to feel very hopeless and helpless. That is both related to inflammation, which, by the way, doesn't happen just in the gut, it happens in the brain. So it could be that you've just really been through a lot and things just kept building up and kept happening and you never recovered in between. And now you're sad. You don't want to leave the house. Maybe you stopped calling your friends. Maybe work is no longer meaningful. All of those are signs that you're really struggling and you need some professional help to be able to reset and refocus. We've done studies actually where we've said, to patients, why do you not bring it up to your doctor? And it's always, well, I don't want my doctor to feel burdened. I don't want my doctor to have to solve the problem for me. I want my doctor to focus on the medical side. When we ask GI providers, why don't you bring it up to your patients? How are you coping? How are you managing
Yeah.
emotionally? The GI providers say, I don't want to be intrusive. I don't want to make the patient feel uncomfortable. So then nobody's talking about it, right? And so
Yeah.
we're really working on both. And places that have integrated GI psychologists, I think, have created a culture in their practice where it's a little easier, right? Like you have somebody down the hall that you can meet with when you come in to see your GI doctor. But I do think that it's way more common than people think. And if you are struggling, if your quality of life is impaired, if people think you're not acting like yourself, or you just think you need a tune up. I think that it's totally let's be proactive, right? Part of our medical care is about proactive, top-down treatment, really trying to be aggressive up front to prevent progression of bowel wall damage. The same is true. We're trying to prevent progression of emotional damage from these
Yeah,
conditions.
and one of the things that I've noticed over the years in terms of the feedback that we get from patients, the questions that we get from patients, no matter whether an IBD patient, IBS, or some other, is they're so worried about, or they've been told by doctors, it's in your head. They're so afraid to bring up these things because of that one phrase, oh, it's all in your head. And, that is such a bad thing. And it's such a huge barrier and a dangerous barrier. And not every doctor is like that. Like you said, you have wonderful IBD centers where they have the full care team and everyone, it's part
Yeah.
of the culture, which is a beautiful thing for patients. But
Yeah.
for those that don't have that, how
Right.
can they navigate that?
Well, right. I mean, I think you're right. It's that fear of being told it's in your head. But some of that is also that strength, that acceptance of like, so what? Even if this happens to be in my head, that doesn't mean
I
it's
love
not
it.
important. It's not real. It needs to be addressed, right? I think we've attributed this idea that like if something's wrong with our brain or our emotion, that somehow that's within our willpower. We just need to pull ourselves up by our bootstraps. But those are just as legitimate symptoms as anything else. And so you wouldn't ignore rectal bleeding any more than you should ignore thinking life's not worth living, for example, right?
How simple is it for a patient? What can they say to their doctor to sort of maybe see a GI psychologist? And then I want to ask you, uh, how what the role of a GI psychologist could be, or behavioral health referral, how that can be really life changing for a patient. So, number one,
Yes.
how can a patient bring it up? What?
I think, you know, just being direct, like, listen, I feel like I'm having some trouble coping, right? You don't need to go into detail. You don't have to talk about your past trauma. Like, I'm having trouble coping right now. Is there someone you would recommend I reach out to that you know of in the community that your other patients might see, that you personally see yourself, right? Who do you think would be trustworthy for me, or is there a resource? We do, by the way, encourage our GI doctors, even if they're not embedded in programs that have all these resources, to at least have the names of a few people in their community who would be willing to see patients living with a chronic disease, right? And so I think that's a very reasonable request. Do you happen to know someone who could help me cope with this? I'm having a hard time. And that's all. You don't need to go into all that detail. And I think that goes a long way. Most doctors are very happy to do that and to support you, and um, don't attach a lot of negative stigma to it. I think they just feel bad bringing it up
Yeah.
if they're wrong.
Yeah. It's amazing to see, and you've been such a pioneer in this area of GI psychology. Like, I remember seeing you on stage at an ACG meeting years ago with the first paper that ever talked about this connection. And now here we are, and you lead the GI psychology area of the Rome Foundation. You have a directory for patients or for providers that need to connect. For patients that may not be aware of the role of a GI psychologist, or they may be some stigma around going to a psychologist at all. Can you just explain briefly how important these GI psychologists are to the IBD care team?
Yes, it's so GI psychologists are specially trained to work with patients living with chronic digestive conditions, right? And so they're a little bit different from typical mental health treatment in that we're really going to focus on how the disease shows up in your life, right? So ranging from I'm having urgent diarrhea because every time I go to the grocery store, I start to worry that I'm going to need to use the bathroom. So GI psychologists can work with that. Two, I'm not sure if I should go on this very, experimental treatment that my doctor is recommending because I tend to have a lot of side effects, or surgery is not really convenient for me right now because have to take care of my elderly parent, all the way to I'm depressed, I'm anxious. We're still psychologists, but our expertise has really been a deeper dive. And we do this through the Rome Foundation. We train our GI psychologists, right, in the brain gut connection, in the impact of medications on your
So
physical
good.
body, right? So it really is nice. If you can't find a GI psychologist, there's a lot of psychologists out there that specialize in something called health psychology, which means they also have been trained in how to interact with your physicians around your care, which I think is also really helpful if you can't find the GI psychologist.
Your article does such a great job, and I really like this part of it when it touches on misinformation. And this is rampant in life all over, but especially troubling for people living with chronic disease conditions like IBD. And how this affects the social media scrolling, the doom scrolling, and how it affects people in general. But then people with a condition like IBD can be even worse. What are your thoughts on that? What did your paper, the key takeaways from your paper, and how can patients find trustworthy support?
No, that's a great question, because we do see a lot of this, and in both positive and negative, right? So
Exactly right.
when you go on, and sometimes there's, the doom of like, my life is over with my IBD, and patients are like, wow, that's, that could happen to me. That's terrible. Right. And the doom scrolling, all the way to like the other's end, which is almost unbelievable, of like, I'm having my hot girl summer with my ostomy bag.
Yeah,
Right.
right. Yeah, exactly.
And that's not helpful either. And so, I think I'm always asking patients, I get the need for the support in the community, and there's a lot of great opportunities out there for support and community. But if you feel, it's really how you feel. If you feel that after you've looked at a TikTok account, or you've looked at a Facebook group, and you feel worse about yourself, or you feel more anxious or confused, it's okay to say that's not the group for me, right? You don't have to be engaged with things that make you feel worse. The point of these is to feel better and to feel supported. The other thing is that what may be supportive at the time, at one point in time, may not be supportive down the road. So when you're first diagnosed, it might be really helpful to hear all the different options that people have when they're being treated, to see what, oh, yeah, that sounds familiar. My doctor mentioned that. Whereas once you're on a treatment, once you're on a pathway, once you've created your care team that you trust, that group may not be that helpful anymore. In fact, it might be just confusing. So I think it is a matter of always checking in with yourself. How do I feel? Is this information actually making me feel better? Is this information leading to my sense of, positive optimism, my resilience? And if it's not, move on.
Yeah. No, those are great points. And especially troubling is like all these natural gut health products. And we don't want patients to, think that that's going to solve a problem. A lot of these people are paid. They don't even may not use the products, and they don't probably have your disease. And this could be very troubling.
Yeah. Right. And even if they do, if you're getting your care from an expert who's
Yeah.
done, don't forget, like, to be an IBD specialist, you've done, obviously medical school, obviously residency, obviously a GI fellowship, and then usually an additional fellowship year or two in IBD specifically. No, like, social
Yeah.
account can can
No.
replace that level of expertise.
Yeah.
So I always ask my doctor colleagues, like, patients are looking on these sites because they're not feeling heard, and these sites do feed into a lot of that quest for validation and acknowledgement of what they're going through, which is great, but they should be able to get that from their doctor. And maybe it's a matter of even questioning, is this the right doctor for me if I feel like I need social media to feel heard and
And
seen?
support it. And yeah, and
Support it.
and I know there are so many great resources, and I know that you had a hand in, putting your framework into the I don't know what it's called,
Yeah.
Trellis Health app or
Yeah.
Trellis Health program. Can
Yeah.
you, explain a little bit about that and how patients maybe want to check it out, how they could check it out and use
Yep.
it?
Yeah. So, with Trellis Health, we've really kind of taken that Resilience 5 and tried to put it into a digital platform that's scalable, right? That you don't have to necessarily be a patient of mine to
Yeah.
receive that level of service. And the way that we're showing up now for patients with using the Trellis Elevate platform, is what we call it, is by pairing it with, new medication starts, right? Because that's a good time. Like, I'm going to be starting a new medication. Is there something else I can do self management wise, resilience wise? We're also, considering, putting it into, obviously, we've tried to partner with some of the insurance companies that say, if you're an IBD patient, you can get this as part of your healthcare plan. And again, all of this is because it's tied to outcomes, right? Like, we don't want patients to have to pay any more than they already are for these services. These should be baked into their care. We know that. We know that scientifically. So it's more a matter of who can we get to pay for it. And so, partnering with pharmaceutical companies, partnering with, um, you know, uh, other people who pay for care, foundations, all of those are ways in which we're trying to increase access to these services.
So is there a website that patients can go to yet?
So you can go to trellishealth.com, but I will say that right now we are not a direct-to-consumer
Okay.
model, but stay tuned because if you are starting certain medications, you may actually hear about Trellis, and they may say, oh, you're starting this new medication and you also get access a year subscription to Trellis. And so I would encourage people to listen for that when they're on medications or asking their doctor or their
Yeah.
insurance plans, are you covering Trellis Health? Are you covering that for
Yeah,
me?
that's why we like to bring it up on here. I didn't think you had direct to consumer yet, but we love to give patients this information so that they can spark those conversations with their doctors, even with their insurers. You
Yeah,
do have amazing outcomes. I mean, your outcomes are amazing.
yeah,
You've shown, I mean, briefly, like tell us a little bit, some of the
yeah.
highlights.
Yeah, so we know that when you build resilience, and we did this at the Sinai IBD Center before licensing it over to the Trellis Elevate platform, we showed that, the more that you are able to build resilience early on in care, the less likely you are to require hospitalization, emergency room visits, all these like costly things that keep you out of living your best life, right?
Yeah.
Opioids, steroids, poor quality of life. And so we do know that wrapping around people holistic care, we, as you know, Jackie, we have an algorithm that kind of tells people what their risk is for poor outcomes, as part of that. And so that we can really say, all right, you're at high risk because you don't have enough optimism, right?
Oh, nice.
You that optimism, or you're at high risk because you don't have enough self-compassion. Right, you're too hard on yourself. How can we build that for you? Because we know those 5 things, those 5 resilience 5 directly tie to your disease. Going a full circle to the biopsychosocial model, the
Mhm.
psychological and social directly influence the biological and vice versa.
Oh, I mean, we could talk about this all day, and I know we're running out of time, but as we close this out, what do you want every IBD patient listening today to remember about emotional healing?
Uh, First of all, it's possible. It should be expected. We should all be driving to that. You can have emotional healing even with an unpredictable disease, right? It is possible because it's all about your ability to adapt, to build your resilience, to look at this as an opportunity. And I think the other main point of this article, really, in addition that emotional healing is possible, is that resilience isn't a fixed characteristic. It's something that can be built with the right interventions, right? You can learn skills over time. And when you have resilience, no matter what happens in your disease course, you'll be able to adapt.
Okay, before I let you go, let's do a quick mindset shift or calming strategy from your Resilience 5 framework that someone could try right now.
I love just thinking about a gratitude journal, right? So we know that if you for 2 weeks straight write down 3 things that you're grateful for, every night before you go to bed, that will improve things as simple as your sleep, your appetite, and your mindset. So I think just being able to say, I'm grateful to be able to share my passion with you, Jackie, with Gastro Girl, with the community, right? I'm grateful that we have such amazing medical treatments for IBD now. We didn't always have that when I started. And so I'm grateful that because our medicines are getting better, we're able to move towards emotional healing. And then, just being grateful to be able to watch the community of people that support our IBD patients, is also really important. So those are my 3 great gratitude for the day, and I think everyone can hopefully find things, even if they're smaller, to be grateful for it.
Yeah, because sometimes we forget. We're so fixated on the things that are going wrong that we forget about the things that are going right. And it
Yes.
does change your mindset. You're like, oh, yeah, I did this today. This is amazing.
Yes,
I
that's
love
right.
it.
Yeah,
Dr.
exactly.
Keefer, you're amazing, and you've done such amazing work, and it's so great have been following your journey and seeing all the great progress you've made in advancing IBD care for patients and providers too. Thank you so much for this compassionate, much needed conversation.
My
Really
pleasure.
appreciate it. And if you're listening and something resonated with you, whether it's the grief life before IBD or the struggle to stay hopeful, please know you're not alone. We've added links in the show notes to Dr. Keefer's article on Resilience 5 and emotional health resources for IBD. And remember, healing just isn't about your digestive system. It's about your whole self, and you deserve that. Until next time, stay strong and stay connected. Don't forget to like, subscribe, and share this episode with anyone you think might benefit from it. And thank you, and see you again.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.